Good afternoon, friends. Today, our topic is about understanding the hypertension. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessels. So this is actually called the blood pressure. The pressure exerted by the blood on the walls. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in the blood pressure higher than the normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity and obesity, as well as smoking, alcohol consumption, stress, insomnia, like that. There are also other risk factors that can also increase the risk of developing hypertension, such as age. Actually, as the people get older, the arteries can stiffen up and narrow as the excess fat builds up in the blood vessels. And the second thing mostly is the family history. If one or more of the close family members with hypertension, it increases the risk of developing the condition. And also, third one may be excess salt intake. This also is the main reason for the rise in the blood pressure. And the fourth one, not eating enough foods with potassium. It also can increase the blood pressure and also can increase the chances of stroke and also this chronic kidney disease. And next thing, eating processed food and fatty foods. So this will also increase the fats throughout the body and also make the heart work harder to push the blood through the body, hence causing blood pressure to rise. And on the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. And another one is the unavoidable one, which is stress these days. So reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. So moving on, hypertension does not have any obvious sign and symptoms. That is why it's often called as a silent killer. It puts people at risk of several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and also blindness also. Hence, it's very important for the early and accurate diagnosis in the management of hypertension. Measuring the blood pressure is the only way to know whether the person is having hypertension or not. Periodic checkups is the important thing in calculating this hypertension. Generally, when symptoms do occur, they include normal morning headaches, tiredness, vision changes, blurring of vision, buzzing in the ears, fatigue, nausea, vomiting. So these are the most common symptoms which we can identify. If person is experiencing some of these symptoms, immediately they should get a thorough checkup regarding the blood pressure and also the remaining parameters also. So fortunately, high blood pressure can be easily diagnosed. It's usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers. That is, one is systolic and the other one is diastolic. Now let's try and understand what does these numbers actually mean. A healthy and normal blood pressure should be lower than 120 by 80 mmHg, and or it can also be read as 120 over 80 mm of Hg. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure. That means the pressure in the blood vessels when the heart rests in between the beats. Okay. If the blood pressure level is more than 140 by 90 mm of Hg, then a person have hypertension. If a person have high BP levels, then there might be a serious risk of developing heart disease. Actually on May 17th, we usually celebrate the World Hypertension Day, a day dedicated to highlighting the importance of monitoring the blood pressure and also the bringing the global awareness to the 1 billion people living in the whole world. The theme of today's Hypertension Day is measure your blood pressure, control it, and live longer. Ensure your BP is measured and control it if it is elevated. Okay. So there are some certain steps which you have to take because to avoid the risk of attacking by the blood pressure. Okay. One is the regular exercise, and second one is the healthy diet. Third one is we have to quit smoking and also alcohol. These are the two major serious concerns, and also regular BP monitoring, stress management, and taking medicines regularly. So these are the main things which you can usually follow very easily, and we can get rid of that high blood pressure. If the blood pressure is successfully controlled with such lifestyle modifications, then there is no need of many medication. So what are the strategies which we have to follow in order to avoid medication? That we will see accordingly. First one is the regular exercise or physical activity. So exercise, what exercise will do is it can be a drug-free approach to lowering of high blood pressure. Regularly, physical activity makes person's heart stronger. So if one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less or to pump the force of the blood vessel, so it will lowers the blood pressure, right? In other case, as well as the age and weight gain, these are also the two important factors for high blood pressure. So if the blood pressure is at a desirable level, that is less than 120 by 80 mm of Hg, then exercise can help to prevent it from raising as you age. Okay, so regular exercising is the main thing. So it also helps in maintaining the healthy weight. So which, in my opinion, is very important way to control the blood pressure. One should aim for at least 30 minutes of aerobic activity, most days of a week, maybe in 5 days in a week like that. High blood pressure level can be reduced by doing regular and structured exercises such as brisk walking, jogging, swimming, dancing, like that, right? That is the first thing, first strategy. And the second is diet. So diet also plays an important role in controlling the blood pressure. A diet with a high intake of vegetables, fruits, and whole grains. Whole grains are also recommended for hypertensive patients. For lowering the blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, and also eating less saturated fat and total fat, and getting plenty of potassium. Actually, potassium has a major role in hypertension, and also limiting the amount of sodium in the diet, and also avoiding alcohol consumption. Okay. In this, what are the DASH stands? Actually, DASH stands for dietary approach to stop hypertension diet. So eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 mm of Hg if having high blood pressure. That's the DASH meat. And also, we have to reduce the sodium in the diet. Even a small reduction in the sodium in the diet can improve the healthy heart and also reduce the blood pressure by about 5 to 6 mm of Hg if you are having a high blood pressure. That means if you are having a high blood pressure in the early stages, maybe at 135 like that, no need of any medication, we can do it with reducing some salt intake. Okay. To decrease the sodium in your salt, you have to consider the tips. These are the tips which you have to follow to decrease the sodium. So one is the we have to read the food labels. Means if possible, choose the low sodium alternatives of the foods and beverages you normally buy. Okay, and also eat lesser processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So you can eat natural products. Avoid processed foods, right? And also one level of teaspoon of salt, 2300 of sodium it contains. mg of sodium. So avoid adding salt to food. Use herbs and spices to add the flavor to your food. And the third thing is quit smoking. Stop smoking. Okay, it helps your blood pressure return to normal. Actually, quitting smoking can effectively reduce your risk of heart disease and also improve your overall health. And fourth one is regular blood pressure monitoring. Some of the hypertension patients check their blood pressure by visiting actually doctors, clinics, in medical shops like that. But it's not always possible for patients uh, to visit doctors and get their blood pressure checkup done. So it's better to advise the patients to have the self-monitoring. Self-monitoring machines are available, okay, to check the blood pressure levels. Self-monitoring helps the person to measure the BP at different times throughout the day over a longer period of time. It also assists doctor to get complete picture of person's blood pressure readings at different times. It also further helps in better preventing prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinical visit. And next, fifth one, stress management. By learning how to relax and manage stress can improve emotional, physical, and also physical health, and also lowers the high blood pressure levels. Stress management requires technique, including exercising, listening to music, uh, focusing on something calm and peaceful, yoga, meditation. These are the things which we can manage the stress naturally. And also adherence to the medicine. A medicine to lower blood pressure may be recommended by a doctor if your blood pressure is constantly high, consistently high, and usually at or above 140 by 80 mm. Adherence to medicine is very important as it controls your blood pressure regularly. And at last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications and also renal complications. It is very much possible to maintain the normal blood pressure levels with regular monitoring and also preventive care, which we mentioned above. So this is the some small information about hypertension. Hope you all got an idea into it. Thank you.